So now I would like to invite our next speaker, Dr. Anita Shrivastava, madam. She is MS FICOG, Joint Secretary IMSCON 2026. She is also workshop convener, Aesthetic and Regenerative Gynaecology Workshop IMSCON 2026. Madam, I would like to invite you. Along with that, I would like to invite the chairperson for this session, Dr. Suman Mali, madam. Madam is senior consultant. Dr. Pomila Sachdev, madam. Madam is also very senior consultant in Bhopal. And Dr. Sadhna Mehta, madam. Sorry, madam, मेरे को आप दिखे नहीं पीछे से. हाँ जी. So now handing over mic to the Anita Shrivastava, ma'am.
Thank you, Dr. Mudita. I welcome all the respected guests and the chairpersons and the invitees from all over India. I'll start my lecture as the role of PRP and the method of preparation. In the outline, I'll just say that I'll talk about what it is, what's in it, what is single and the double spin, what are the controversies, and some indications. So we define the platelet-rich plasma as is also known as autologous conditioned plasma. It is a concentrate of plasma protein derived from the whole blood, and it is centrifuged to remove all the RBCs so that the platelet number is increased. It has the platelet concentration above that is contained in normal baseline plasma. So this is not the general plasma. The platelet contains about 30 bioactive protein which may have a fundamental role in tissue healing. This is the base. The platelet contains high concentration of cytokinins and the growth factors stored in alpha granules. So when we stimulate the alpha granules, these are released and they work as a tissue healing product. These growth factors include platelet-derived growth factors, and there are many. I'll just skip the name. So for example, if there are 2 lakh platelet in a microliter, when we concentrate it, we make it up to 5 ml contains 5 billion of platelet. So this is called platelet-rich plasma. How it is prepared? The venous blood, 15 to 50 ml, is withdrawn from the patient's arm in an anticoagulant tube. The recommended temperature during the process is 21 to 24 degrees centigrade to prevent platelet activation. If the activation is done beforehand, that platelet-rich plasma is of no use. So then the blood is centrifuged at 1200 rotation per minute for 12 minutes. The blood separates into 3 layers, upper layer which contains plasma low in platelets and WBC, an intermediate thin layer or the buffy layer which is rich in platelet and WBC, and the bottom layer which contains RBC. Nearly 30 ml of the venous blood yields 3 to 5 ml of PRP. The upper and the intermediate buffy layers are transferred into a sterile tube. The plasma is again centrifuged. This is called the second spin. At 3,300 rotations per minute for 7 minutes, it helps in the formation of soft pellets at the end of the bottom of the tube. The upper 2/3 is discarded and the lower third is again reconstructed into the PRP, the amount which is needed for us. So this is the thing, the upper plasma level, then the WBC and the platelet, and the lower one is the red blood cells. So if we separate 10 ml of blood, the 4.5 ml the RBC containing blood is removed. So the platelet comes into 5.5 ml of blood. If you are doing the single spin, you will like to use the middle one, the buffy layer. The lower, which is marked by the red, is discarded. In the second spin, when the upper portion is platelet poor plasma, so we have to remove the upper portion and we have to use the lower portion. It is very important to understand, if we spin for the first time, the concentration is 1.7x, 1.7 times. But if we take the upper and the buffy coat and respin it, then the concentration comes up to 7 times. So we need at least 3 to 5 billion of platelet in per milliliter. There are tubes available for that, and they are the tube with 8 ml, which contains 8 ml of blood with anticoagulant, or 30 ml of blood. So that contains 22 ml of blood and 8 ml of anticoagulants. Two types of tubes are available for that. When we prepare, so according to the gel tubes, if we want higher number of platelets, we have to withdraw more blood and we have to go for the second spin. When we do the second spin and prepare the plasma, platelet-rich plasma, we have to activate by adding some like calcium chloride or some other things, or we have to shake it to activate the alpha granules to release the cytokinins and other things. There is chart available which says how much blood you have to centrifuge to obtain how much of the PRP. A larger initial blood does not guarantee the centrifuges process will efficiently recover the platelets. The processing is ideally done with a double spin centrifuge protocol for adequate platelet concentration. So there are few mistakes which people do. The platelet concentration is not good, so that should be 3 to 5 ml. Second thing, the second mistake which they do, they apply the PRP at different places. So each place does not contain the proper amount of platelet which is needed. So you have to decide which point you desire the most effect. So you have to put the plasma, platelet-rich plasma at that point so that the adequate concentration of the platelet is there. The third mistake, the patient does not stop taking NSAID. NSAID should be stopped at least 1 week prior to PRP, because the platelet will not be able to initiate the cascade of growth factor release necessary for a proper response of NSAID. If the pain is mild, you should tell your patient that this procedure will be a slight painful because you generate an inflammatory process under the skin. So there will be slight pain and she has to bear it. If it is unbearable, you can prescribe Melecoxib or Celecoxib. Fourth, the delay in injecting the PRP. If you prepare the PRP and then you have to rush to apply it to the patient. If you delay, then the cascade will initiate in the gel tube only and you will not be able to inject whole of the plasma, or it will be converted into fibrin, or that will be not very effective. So the mechanism of action of PRP, the growth factors promote wound healing by initiation of the following stages: resolution, chemotaxis, cell regeneration, cell proliferation and migration, extracellular matrix synthesis, remodeling, angiogenesis and epithelialization. We use PRP at various places. Therapeutic applications are there and the aesthetic applications are there. For example, therapeutically, we can use it for cervical ectopy, vulval dystrophy, reconstruction surgery after vulval cancer, reproductive medicine, premature ovarian failure, ovarian torsion, refractive endometrium, implantation failure. In perimenopausal patient, if she wants pregnancy, then for the ovarian regeneration, we can use it. Urogenital disorders, genital fistula, genital prolapse, urinary incontinence. In orthopedics and dermatology, it is very widely used. And in aesthetic, we use it for breast reconstruction, vulval reconstruction, female sexual dysfunction, vulvovaginal rejuvenation, O-shot therapy for sexual dysfunction, and dermatologically for acne, scar, and facial regeneration. There are many studies available since 1970 to till date, and many large studies are still going on. I'll not go into detail of all the things, but PRP in vulval region is very effective. It is injected in the vulva in the fanning pattern. The patient receives 3 PRPs in 4 to 6 weeks apart and again after 12 months. And this gives a very good result in lichen sclerosis, as well as the vulval reconstruction after vulval cancer. There is June vulvitis. It is also a very rare disease, but nothing works, then we have to give PRP. Vulvodyna, PRP is very good. One of my previous speaker told you about that. In vaginal infection, we have known if the vaginal conditions is improved, the infection will not go. In cervical ectopy, we have to give minimum 2 applications. In genital prolapse, in the first degree prolapse, if you apply PRP, it is effective, and when it is clubbed with chair or chair therapy or exercise, it works very well. In genital fistula, if it is very small, we have to refresh the fistula, we have to apply PRP and the fibrin matrix on the fistula. The small fistula heals in 4 to 6 weeks. In stress urinary incontinence, it is very much used. It is very common problem. It is PRP is rich in growth factors and cytokinin, which regulates the tissue reconstruction and has been studied extensively among the trauma patient. Use of PRP can be given as a given as a Q shot and the O shot, and also as the G shot. The 4 cc of PRP injection is given through a 27 gauge needle to the anterior vaginal wall into the space between vagina and the urethra, a most distal part from the bladder and around the bladder neck. O shot or the love shot, everybody wants to know about it. It is a non-surgical tool to treat patients with FSD and urinary incontinence and rejuvenation of the labia majora. The 2 injections of PRP are given by the 27 gauge needle in the anterior vaginal wall in the space between vagina and the urethra, and 4 injections are given around the clitoris at the 12, 3, 6 and 9 o'clock position. The benefits include greater arousal from the clitoral stimulation, younger, smoother vulval skin, a tighter vaginal opening, strong and more frequent orgasm, increased libido, lubrication, less pain in intercourse, and even decreased urinary incontinence. For vaginal rejuvenation, vampire or the vagina injections are given. It gives a vampire wing lift is a very common office procedure, which gives almost a natural look and natural aesthetic to the vagina. In Asherman syndrome, endometrial rejuvenation, implantation failure, ovarian rejuvenation, ovarian torsion, wound healing, and the treatment of keloid, as we have already talked, PRP is very useful. One thing about FDA approval, PRP does not require FDA approval since it is not a medicine or a device. PRP comes from the patient's body only. Patient own blood is withdrawn and it is processed by FDA approved collection kit and centrifuged to concentrate the platelet in 5 to 6 times. So what are the contraindication? The individual who smoke because their platelet function is not well. The patient who have skin cancer, who have liver disorder, or who have blood clotting problem. The adverse reactions are very rare. They are more like bruising. So the take-home point is platelet-rich plasma. The theory beyond this modality of treatment was derived from the natural healing process, as the body's first response to tissue injury is to deliver platelet to the injured area. Platelet promotes healing and attracts stem cells to the site of injury. From basic science to clinical practice, PRP injection is applied in diseased ligament, tendons, and joints for the repair. A vast variety of active signaling molecules are found in PRP, which is responsible for the onset of inflammation, stem cell migration, angiogenesis, and cell proliferation. So it is affordable, simple, cheap, easily performed, effective, non-invasive thing. We can use it in a large randomized control studies for various gynecological procedures. Thank you. Thanks for listening.